One thing my patients have definitely taught me over the years when it comes to gender affirming surgery is it's not one size fits all, and some patients may never want or need surgeries. But when it comes to surgeries themselves, it's important to have different options to offer different folks and to educate our patients about these different options. So here we are. My name is Dr. Clive Gallagher. I am a plastic and reconstructive surgeon based here in Miami, Florida. And in this video, we're going to talk about scrotoplasty, which can be a really nice adjunct to orchiectomy. So this is for trans femme patients, folks who are assigned male at birth. We also obviously can do it for folks who are assigned female at birth, who are getting bottom surgery. But in this case, we're going to focus in on the girls. And so what this means is when we do orchiectomy, and I'm seeing a growing number of patients who maybe that's all they ever want, just to remove the testicles, or they're getting it early because they want to control their hormone levels, and it's just a nice next step in their transition. If, however, we remove the testicles, obviously we are going to have an empty scrotal sac left behind. And in some patients, this can bother them, that extra skin there. So scrotoplasty is usually just a technique to come in and clean up that scrotal skin. Typically, depending on how much tissue that is there in the first place, we're doing about a 3 to 4 inch incision to tidy this up and get rid of it. And this can help with tucking, it can help with the aesthetics of down below. And so for some patients, this is an ideal procedure. And of course, we can combine it with orchiectomy at the same time. The caveat with this surgery is I strongly do not recommend getting it done if a vagina is in your future. So if bottom surgery with vaginoplasty, we want to leave all the spare parts we can behind, because even with the newer techniques like the peritoneal technique, it is useful to have more healthy tissue down there and not extra scars to be dealing with. It may be possible in the future to do vaginoplasty, and I have a couple of patients I can think of on the books, and I've done it in the past, but ideally you want to leave that tissue because typically the results aren't going to be as natural or as aesthetic as they would have been if I had all the tissue left behind, even in the case of peritoneal vaginoplasty or a zero depth procedure. So I always strongly recommend, if bottom surgery, future bottom surgeries are in your future, do not do a scrotoplasty at the same time. But for folks who know that orchiectomy is it for them, it can be a really nice adjunct, and all your stitches are dissolvable down there. Really doesn't add too much to the recovery from orchiectomy alone. And so for some trans femme patients, this can be a lovely option.